the opportunities, I think, there are quite a number of opportunities in the healthcare sector in Nigeria. Obviously, we're talking about Nigeria, but for me, it's mostly about Lagos, because Lagos is where the hospital is based. And that is the opportunity to provide excellent
I heard
standards
you.
of medical
Ìgbà
care
tí mi sọ pé Àǹṣebú sọ pé
to
life
the
ẹjọ́ máa wà ní the same
population.
place. That was after.
Sorry about that. I'm
I
gonna
think
mute.
someone is going to have to mute.
I've just done that. Sorry about that. And then please, you go ahead and unmute, please. Thank you.
Okay, I think that will work better. So we're talking mostly about Lagos, but seeing the opportunity to provide excellent standards of healthcare for Nigerians in Nigeria. Now having Marcel Ruth will be operational 4 years in December. And I think for me, I was not in Nigeria for quite a long time, so maybe missed the period where there was a lot of patients just basically leaving the country to go abroad for all their care. What we're trying to do now, we're managing to do, I think, is to provide the type of healthcare that patients would receive if they went abroad. So a bit of a reverse medical tourism, I think, is probably what you would be saying. We're being able to provide, certainly in the private sector. So we've been operational just about 4 years. We've seen almost 4,000 patients in Marcel Ruth. We see patients coming from all over the country. We're now seeing patients coming from neighboring West African countries, including Liberia in particular. In fact, the ambassador came to see us because he couldn't understand, what we were providing that would allow the increase in visa applications, for example, for people wanting to come into Nigeria to come and seek medical care. Patients from Cameroon, a few from Ghana. We're now seeing patients coming back from the UK and in the US, and in particular, when patients go for their maybe wellness check or for some other reason, some are visiting relatives, they get a diagnosis made, and if they don't have insurance, then medical care abroad is extremely expensive, particularly in the oncology sector. And what we're finding now is these patients are coming back, and they're actually coming back because, particularly in the UK, there are doctors in the UK who are now telling them that they're aware that we exist and saying to them, look, it's better for you to go back and have your treatment at home, nearer your relatives and so on, but also so that you don't run out of money here and run into problems. So I think for me, that's been a huge thing to have that sort of impact, and particularly delivering care for cancer patients. When, the time when they've been diagnosed, it's not the time for them to now be getting on a plane to go to India, South Africa, the UK. And cancer treatment takes quite a long time to deliver. The majority of our patients are being treated for 9 months, sometimes a year, because they require chemotherapy, surgery, and radiotherapy altogether. So if they went abroad, they'll be away from their home, their family, their friends. Most of them will have to stop working at a time when they need the money to pay for their care. So for us to be able to deliver this care in Lagos for Nigerian patients has made a huge difference in terms of them being able to be at home. The other, I think, for me, the positive things, and because in my career, I did a lot to do with teaching and training. I was postgraduate tutor at the London Deanery. I also did quite a bit of research, and what we've been able to set up at Marcel Ruth is actually an active teaching program. And in fact, in the last few weeks, we've just been accredited by the National Postgraduate Medical College to run a residency program for oncology, for clinical and radiation oncology. We'll be the first private hospital to be giving this opportunity. So again, fingers crossed, we'll not just be reversing medical tourism, we'll be reversing the workforce feeling that they have to leave the country to go and train abroad. So that's another thing. And it's just so much, really, I think, in terms of being able to improve healthcare. I think the challenges we can talk about obviously the challenges in running any type of business in Nigeria. At the moment, of course, we have major issues with electricity and so on, which I'm sure and the cost of treatment, I think, for the general population remains a big one, but I think there are other people on this panel who are more experienced in trying to discuss the financing of healthcare. But from my point of view, because people always ask me this question, and I can, from the bottom of my heart, say that I think it's probably one of the very best things I've ever done in my life. I'm really grateful to God for this opportunity to be back in Lagos, to be working alongside colleagues who I trained with or not, both in the public sector. I do a lot of work with the associations, the guilds, the medical women's, and so on. And it's huge seeing the amount of work people are trying to do in the public sector with hardly anything to do it with. And so it really should be applauded for it. But like I said, for me, it's been incredible to be back at home and to actually day to day be able to try and improve not just healthcare for patients, but to be able to teach and train. And we're also doing quite a lot in the research and development area, which I think maybe I'll leave for a little bit later on.
Good.
Thank you.
Yeah, thank you, Doctor. And it was important to actually let you exhaust your thoughts on that, because again, you know, sometimes we see doctors and we just think one way. We just consider we're boxing them up into that, you know, that white coat as well as the lights in the room. But as an entrepreneur that you are, because that's really what you are as well. That's why it was important for us to allow you to really exhaust that thought process and really share light from a diaspora point of view, as well as an on-ground, you know, citizen right now who's actually giving back to the community and the sector as a whole. So thank you for sharing those. Definitely will be coming back to you to, you know, with leveraging more specific questions with regards to your cancer treatment focus, as well as some of the trainings that you said. You know, it would be good to actually dig into that some more. So we'll be right back to you. But again, still the same question. What's the current reality of the sector in terms of challenges, opportunities, and regulations? And we'll go over to you, Dr. Jaffet, speaking from a public sector point of view, and then we can cycle back to, you know, our other two guests. Dr. Jaffet. Yeah, you could unmute and
Okay, thank you very much once again for having me on this webinar, and greetings to all my senior colleagues on the call. Dr. Lebuti Odrison and I have been on a couple of programs together for the NMA and medical guild. So Dr. Shuni, a mentor that we all look up to, and same with Dr. Gumbi. So my special regards to you all. Said, I'd like to start from the point of view of the primary care system in Nigeria, and I will be using Lagos as a reference point. In Nigeria, the PHC system, the primary care system, is the grassroots healthcare sector. That is a healthcare sector that caters for the ordinary man in the community, the grassroots population in the community. So it's the first point of call for the people in various communities. And whatever we want to do, we'll start from there. The PSC system is expected to cater for immunization activities, treatment of minor ailments, family planning, vaccine, and on and what have you. But the problems we have in Nigeria can be categorized under the 6 building blocks of the health system, which will include the leadership and governance, problem with healthcare financing, service delivery, workforce, and then we'll be talking about things like infrastructure and service delivery as well. So if you start looking at this from the point of view of leadership and governance, you would see that it's the same problem that we have in Nigeria. A lot of people in charge of the PSC system are not true to the system. They're not doing what they ought to be doing. They probably, some of them are probably not the right peg in the right hole to provide the required leadership that we should have in that kind of sector. And I'm not talking about the national level. I'm talking about at the local government level or at the state level. If you take Lagos, for instance, Lagos is doing very well in terms of the PSC system, the organization, service delivery, and what have you, because they have a lot of firsts that we can mention, that we can, credit to their name. But in other parts of the country, especially in the Northwest and the Northeast, it's a sore case because the problems, the challenges tend to rise from the fact that we do not have medical practitioners or public health physicians being in charge of the PAC system in this part of the country. Apart from that, we have a dearth of infrastructure. Infrastructural development. It's a major eyesore in the PAC system. And if you are conversant with the social media space, you would see a lot of dilapidated buildings, a lot of buildings that are situated in hard-to-reach environments, a lot of buildings without power, without water, without good roads to create access to community members who may wish to visit these healthcare centers. So we have several of these in different parts of the country, and even in Lagos here, we have some PACs that are not functional. So we have infrastructural debt in our PAC system in Nigeria. And of course, we all know that image is everything. I mean, somebody wants to bring his wife to, register for ANC at a PAC center, or to deliver at a PAC center, and you look around in the environment, you look around the structure, and you're like, oh no, my wife cannot deliver here because you have moth-eaten roof, or the roofs are off, or there's no water, or there's no fence, there's grasses everywhere, there's no power in the center itself. So how do you even expect the workers, the healthcare workers in that kind of structure to be able to deliver their services very well? Then apart from that, you have a dearth of consumables and commodities. I remember back in the days when we were in training, once you just go to the GOPD or the emergency room, all you need to do is just look at the nurses station, and all the consumables that you probably need to attend to patients are there for the taking. And we used to stock some of them in our ward codes at, as house officers. And, cannulas, cotton wool, plasters, all those items we used to stuff in our ward code so that it makes the work easier for us, it makes the work faster for us, the response faster, as the case may be. But nowadays, you visit some of these PHCs, you can't find any of these, maybe because there's not enough money to purchase, or because money has been voted, somebody has, decided to use the money for something else. So you don't find adequate commodities, adequate consumables. You don't find enough equipment. There is a report by the NPACDA. NPACDA is the National Primary Healthcare Development Agency, which is the organization that is in charge of PACs and PAC services in the country. And they reported that less than 25% of the PACs in the country actually have up to 20% of the equipment, minimal equipment required to run a PHC system in the country. So you can imagine if you don't have up to 1/5 of facilities that have the right tools and equipment and machines that they need to attend to patients. You can imagine that such centers cannot, judiciously attend to patients. They cannot judiciously contribute a positive indicator to the healthcare outcome in the country. So PHCs do not have sufficient commodities, they do not have sufficient consumables, they do not have sufficient equipment to run their centers. Apart from that, the finances to purchase drugs, to stock drugs, to pool vaccines to the PAC, to pay the workers, to paint, give some form of aesthetics nature to the PAC is also lacking. To address this, the federal government actually inaugurated what they call the Basic Healthcare Provision Fund, the BHCPF, in 2014, and I think it came into operations in 2015, thereabout. So this fund is supposed to be derived from the Consolidated Revenue Fund, 1% of it, to assist the PHCs, to give some form of financing to the PHCs. But in the past couple of years, the finances have been dwindling. They've not been stable. Yeah, of course, the fund itself is even very much inadequate. But of course, if it is delivered when it should be delivered, it will at least bring some sort of succor to the PHC system. But the funds have been dwindling, maybe due to political will or budgetary allocations and what have you. So we have these problems, beleaguering the PHC system. Then we have the workforce, which is almost inadequately trained. Like I said, if I start using Lagos as a reference, Lagos has almost near adequate workforce in the PHC system because they are the first to start inserting doctors, medical practitioners in their PHC running 24-hour service in the country. If you travel up north and some other part of the country, you will find that the only cadre of healthcare workers that you would find in the PHC system are probably maybe a nurse or a community health extension worker, which is inadequate, grossly inadequate to run a PHC where people are expected to come for family planning, come for treatment of malaria, come for immunization, come for TB diagnosis, come for all sorts of other activities that go on in the PHC system. So, and when you have this workforce, they should be, naturally be undergoing training and repeated trainings and on-the-job monitoring. But this is lacking, of course, partly due to lack of political will, or largely due to poor financing of the PHC system.
So, Dr. and I'm sorry to interject you there. I want you to hold your thoughts there, because again, you've really, approached this from a different angle that personally I didn't even see coming, right? I knew we were going to talk about the healthcare sector and also, the public and private sector, but it was really, really important to actually have you emphasize the PHCs, because you're absolutely right. I mean, the PHCs are the foundation of any economy. So I would want you to please hold your thoughts there. You're already providing some of the solutions, even though you're identifying the challenges, which of course our audience here are listening on. But I would want to just, go over now to Dr. Doyin Ogumbi. Again, we're proud of what your institution is doing. We know you coming in from a private sector point of view, listening to some of the things that, Dr. Japheth just shared. Again, the questions still remain same, and you can actually share your insight with regards to that. In your opinion, as a returnee, as a citizen right now rendering services, what are your genuine opinion on the current state of our sector, of the healthcare sector in Nigeria, and of course the region you might be also operating in, with regards to challenges, opportunities, and regulations? Dr. Doyin.
Thank you. Again, an honor to be on this panel, an honor to be on with these fellow guests who are very knowledgeable. It is wonderful to hear Dr. Liberty Olusin's thoughts, interesting perspective as a returnee diasporan, and I think I share with her. The notion that this is the proudest work of my life, and I'll be able to return to Nigeria, and I share with her and all our guests, and of course our experts, including, and of course primary healthcare, which is the most important, the most fundamental aspect of our healthcare. That Dr. Olubogi has enunciated. We all have identified some very important and critical aspects to healthcare in Nigeria, and one of them, of course, is financing. The money is the fuel, is the it's a very, very critical commodity that we need to not just build the infrastructure, but maybe even more critically to maintain the infrastructure, to train our workers and to retrain them and continue to train them to keep the equipment up. There is no healthcare organization in Nigeria, even maybe a well-appointed private one. I'm privileged to be at a nice facility. Dr. Olusi has built an excellent facility there, but to maintain it, it takes money. Most of the healthcare is paid for in cash and private pay. Of course, we have the HMOs are represented on this panel, and they do an important job. But in general, we need more robust source of funding in healthcare in Nigeria. Of course, the government needs to do its part. The government in particular needs to concentrate on public health, on primary health care, making sure that those primary health care facilities are well equipped, and adequately well built, and to maintain them, of course. And that, of course, needs good funding. And then the other thing that the government really needs to do is to establish good minimum standards and to enforce good minimum standards to be practiced by everybody, both in public and private, and to hold all medical practitioners to account, hold us up to high standards. And so I think those are the areas that the government needs to help out most. If the healthcare funding can be more robust in Nigeria, because government has its part to play, but private insurance really, I would call for private insurance to provide robust health insurance products that will allow at least the middle class to be able to purchase decent health insurance and to be able to pay for good health care in Nigeria. Increasingly, we have excellent facilities in Nigeria, such as Dr. Olusi's facility, and I would say mine as well, and several others, especially in the big cities. But it takes money. Patients, it can be, even though it costs less, of course, for patients to stay in the country and come to our facilities. If we are reversing medical tourism, Dr. Lucy is doing that, Duchess is doing that, and other facilities are doing that. And yes, it costs less to come to our facilities, but it still can add up, especially if somebody's very, very ill, especially if somebody's in intensive care units. Oncology, cancer care is not cheap. Even though, again, Dr. Lucy can provide better value that they can get in going to Britain or to US or even to India, but still it adds up. So if people could have robust health insurance, that'll help them to pay for good health care in Nigeria. So those will be the main points I'd like to attend at this point. Thank you very much.
Thank you, Dr. Obubi. Just as Ubi said, you hit the nail on the head straight up with it. And I like the way you actually balance that out, because again, the role capital plays in all of this, sometimes we think is just come in and actually build a facility. But I love your emphasis on maintenance, on skill development, retraining the trainers, so to say, and also, coming in from the medical insurance point of view, because again, we are fortunate to be out here in the diaspora, and we know what's really driving out here is not just because people are able to pay directly out of pocket, but it's really that balance of, medical insurance that gives people that privilege to be able to tap into the solid infrastructure that is out here. So I'm really glad that you nailed that in, and I'm also excited because the next speaker, that's literally is his cue. So you basically just channel the conversation directly where I wanted Dr. Oshuni to also share some more insight on. So Dr. Oshuni, again, still referencing challenges, opportunities, and regulation, but now you can also speak a bit more from your core expertise on healthcare management, the insurance angle to it, and also further thoughts. Dr. Oshuni, over to you, sir.
Thank you very much, Sahid. It's a pleasure being here. It's funny that more people have drawn my attention to this event than any of 20 events before this. Everyone seems to, want me to be part of this, and they see my face on the flyer, and they draw my attention to it. So
Awesome.
it's been very well publicized.
Appreciate it. Thanks to the team.
I visited your website, and I get the impression that your organization is geared towards assisting people who want to invest in Nigeria to come back home to do so and to facilitate that process.
That's also correct. Yes.
Because my interest and expertise is in health finance, I'm going to start from a broad base and then narrow down to health. Every single industry in Nigeria is underserved: banking, agriculture, health, education, everything. And that reflects in just how much finance is available to do anything. Now, let me give you some numbers. The per capita income of America, United States of America, is some $6,000 per annum. For Nigeria, it's more like 1,500 to 2,000. It's a moving target because the exchange rate keeps on fluctuating. So disposable income is microscopic here compared to the United States of America. It's very interesting to note that the budget of New York City is about something a little over $100 million, whereas the budget of Nigeria for 2024 in dollar terms is in the region of $15 to $20 billion. So there's more funding in New York City that has 8 million people, 4 times more funding than in Nigeria that has more than 200 million people. And you will observe that, the Dr. Ogumbi and Dr. Lubogi emphasize this issue of finance. I'm trying to draw a picture here of inadequacy. Now, our GDP moving target also between $300 and $450 billion per annum. Of that, about 3% goes to health. And that translates to a sum of about $9 billion to $15 billion. Okay. The health industry in America is a $4.4 trillion industry. It's always a surprise to me when people expect American standards of healthcare in Nigeria. It's just not going to happen. So we're coming closer home. Our GDP is not very good. But worse still is the fact that Nigeria is not a nation of taxpayers. Our tax to GDP ratio has been put at about 8%. But in reality, if you calculate it, it's actually about 5%. What does that mean? For every $100 generated in Nigeria, only $5 is paid as tax. So even government is underfunded. Whereas in South Africa, the figure is 26%. In France, it's about 45%. European countries generally will do 35 to 45%. And what that means is that the federal government budget for health for 2024 is in the region of $1 billion. Right? Of that $1 billion, $800 million is recurrent expenditure. And only $200 million is capital expenditure. That means the federal government is budgeting $1 per Nigerian for capital expenditure. It's a joke. We're not going to get anywhere, with those kind of monies. If you contrast Dr. Elebute Adusi's session with Dr. Lubogi and Dr. Ogumbi, you will find that it's very interesting. The two later speakers were more public sector aligned, and they highlighted the problems. Dr. Lubogi spoke of the time when you could actually pick up materials on the tray and get a cannula, you want to set up a drip, it's all there. But we can no longer do that. Dr. Elebute Adusi is a heavily funded private sector person. And it shows what can happen if enough funds go into health. You know, if you go, I have been to Massive Growth, and you could be anywhere in the developed world. You could be in London or Sydney or New York. It's a superb environment, spotlessly clean, not a cobweb in sight. Fragrances, you know, assailing your nostrils as you enter into the hall. You know, state of the art. But I have also been to some health centers which will take your breath away at the sheer dilapidation of the health system. So what do we need to do? In our own industry in health finance, the HMO industry,
Right.
we know that the premiums are too low to make the kind of impact we want to make. Average premiums in Nigeria are $30 per person. Average premiums in America are $10,000 per person. And people expect the same level of care, a Mr. Ruth level of care. No? So what do we need to do? The country needs to grow wealthier. So I encourage everyone listening from Napac CDI, please come back home. Come and invest, create wealth, start farms. You're driving from New York to Washington, it's corn all the way. Come back and do that here. You know, let the country be really, truly wealthy. And then the country also needs to pay more tax. People need to pay tax. The excuse is, oh, if I pay tax, they will steal the money. But it's a bit of a chicken and egg situation. If you don't pay tax, everything just goes downhill. So not enough money is coming into funding, and we're thinking of all sorts of solutions, including, and you may not like this, the audience may not like it, a tax on remittances from the diaspora. So if you send $1,000 back home, we may be taking 10% of it or 5% of it just to shore up our health system. I think I should close on that alarming note, and discussion continue. Thank you very much.
Well, very soon my phone and inbox with my colleagues will be blowing out that, okay, this is what you called us to come listen. I guess we're working for the government now. But full disclosure, Napac CDI does not work for the government of Nigeria, nor the government of the United States. We're a private sector funded corporation for profit. But we appreciate the insight you just shared, you know, Dr. Oshuni. I mean, again, I didn't see that coming. The emphasis on the diaspora and the roles that we play in not just the healthcare, but the economy as a whole, because once there is substantial and enough fund in the system, I do agree with you that, you know, we could be able to do a lot more. But I would take a quick pause here to actually thank all our panelists for the beautiful input and insight that you've all shared so far. You've actually triggered not just the thoughts of most of our attendees, but this communication goes to our entire diaspora community here in the United States, across Europe, across Asia. Napac CDI is a for-profit entity, as I earlier mentioned. We are focused on leveraging the expertise, the skill sets of the diasporan community, Nigerians in particular, okay, to complement the efforts of professionals like those that we have our guest panelists today to build on our economy. Nigeria is our primary country of focus. We are focused on the continent as a whole, but leveraging our root base, what we call home. We are glad with some of this insight that has been shared so far. We encourage you to visit our websites. We're building a strong database of professionals for you, so you can go on there, register your skill set, let us know exactly what your expertise are. Our primary goal is to find and secure prospect projects, both from the public and private sector in Nigeria, and rely on the expertise of individuals like yourselves, so we can actually not just, you know, talk the talk, but also, you know, walk the talk, as it were. So again, I encourage you to visit our website, reach out to Ross, engage the use of their chat box, and we'll be able to, you know, respond to you or basically refer you to some of our panelists, and visit, you know, our social handles as well for some of the previous webinars and would be able to also share more light should you find specific interest areas or conversations that you'd like to spark up. Having said all of this, thank you again to our guest. I would love for us to, shift the conversation a little bit into technology. Now, we do know the place technology plays in our current, again, world, as it were. Yes, we understand the infrastructural challenges. We understand also the need for finance, but perhaps we can also try to share a bit of light on how Nigeria can actually, leverage what it's its own issues, okay, and use that to also create opportunities and solutions to some of the things, being addressed in the world from a medical shortage standpoint, but leveraging on technology. And if you can also share some insight on how are you using technology to improve on some of your services and perhaps also address the need for perhaps that higher level of expertise that might be lacking in country. And for this, I would like to, start with Dr. Lubugi. This time around, I'll be pretty strict on our timing because, again, we're very keen on time at Napac CDI. We did promise it's going to be an hour, but we said this was going to be an interesting one, so we kind of extended a little bit into about 90 minutes. So we implore our attendees to please bear with us. It's been a very insightful, thought-provoking conversation so far. I would like to call, have a call to action before we leave, and we'd love you to be a part of that. So, Dr. Jaffet, in 2 minutes, if you could share your insight on how you are leveraging technology or how you basically see opportunities within the technology space from Nigeria to even influence the world. Dr. Lubogi. And you can unmute, yes. Okay, you can unmute.
Okay, yeah, thank you very much. I think we need to be thinking of digital health and telemedicine to be able to solve some of our problems. The electronic medical record allows for data and information sharing very easily. It also helps to improve patient outcomes from reducing the long waiting time. And it also helps in, to keep perfect medical record. So we should be exploring this electronic medical records and digital health. But of course, one of the major challenges we have in the public sector is power. If you want to, run that kind of system, you have to have 24 hours power. But we can leverage on the solar battery charged materials and use electronic medical records to improve our practice in the public space. I think some hospitals have already started this, especially the tertiary and the secondary ones, and it should be downscaled to the PHC system. Some PHC in Lagos have already started, embracing this. The government is downscaling from one PHC to the other and, test running the system to see how well it will run. And of course, those which the areas, the PHCs that they have tested this, they see marked improvement in the system, and it helps to improve patient outcomes. So we should be looking towards this avenue. We should also be looking at creating apps to help in public health service delivery and medical delivery, especially those who are far off or who do not have easy access to some, medical facilities. Telemedicine can help to create that bridge and reduce and improve universal health coverage, as it were.
Thank you, Dr. Lugi. Again, speaking more from the, primary healthcare perspective. And of course, we know there's a growing charge for alternative source of energy. So we're hoping that that also could actually help address some of the challenges to power. But we'll go over to Dr. Elebute real quick. If you could share, ma'am, how are you leveraging technology? And more importantly, how are you basically seeing the use of technology to educate, the common man, so to say, loosely the word common man in Nigeria to understand that these resources and these opportunities are now in country for better and improved, healthcare service delivery. Dr. Lupte. Yeah, okay, so, yeah, there we go. You should be able to unmute yourself now, man.
Thank you very much. So I think, just thinking about it, I might take this from a slightly different angle, just in case I don't have another opportunity to speak, because I can also see some of the comments in the chat box, which is to say that for your audience, like Dr. Shini was trying to address as well, and because I'm somewhere where there's a group from medical school celebrating a 50th, and the same questions all the time for those who remain in the diaspora. It is doable to come and work in Nigeria. It is. There's a lot of work to be done. There's a lot that you can do. And you don't necessarily have to do it by coming back totally, which I think there are one or two people on this platform are thinking of doing. And that's where the technology comes in. So for example, we have a tumor board every Thursday from 4 o'clock to 6 p.m., which is where we discuss every single new cancer patient that's come in the last week or so, just like we would be doing if I was working in the UK. And we're able to do it because we use, well, it used to be Zoom, but it's one of the other platforms now. Our radiology is reported in the UK. So the radiologist is on, histopathologist is on. We have 6 oncologists who join us every week. I'm extremely grateful to them because they won't take a penny from us. Most of them I'd never met before in my life until about a year ago. Most of them contacted me by LinkedIn to say, we gather you're mad enough to go back and work in Nigeria. How can we help? And I said to everybody, we need your intellectual property to ensure that we're doing things the right way, that whilst we're staying in Nigeria from time to time and without the colleagues that we would normally have around us if we were in the UK or the US, that we remain current and ahead of our game, and that we're providing patients with care. So that's where we use technology. It's made a huge difference. We have 3 colleagues from the UK, 2 from the US, 1 from Toronto, who join us every Thursday. We've been doing this since 2021. People told me it would never last. We're doing a tumor board every week with the surgeons, urologists, our own oncologists, and so on. It's been a fantastic way of using technology. The patients are aware that we're doing this, and therefore they trust that what we're doing is correct. Because one of the big issues with medicine in Nigeria is not far from the costs, is the trust. People don't trust that they're going to get the right diagnosis. They don't trust that they're going to get the right treatment. So even when you tell them, and we've gone through this process, they spend half their time still finding doctors in the US, in the UK, and so on. So messages to those listening today, this is doable. There is regulation. There are regulators in Nigeria. We brought back a state-of-the-art true beam radiotherapy machine to Nigeria, which is one of 10 machines in the country. We brought it back under regulation, but we did it totally, everything we've done, I will also say openly here, we didn't pay anybody any bribe to do anything. Nigeria has the regulation. It had throughout the whole practice and so on. But working with the regulators, I mean, they were so delighted that we were going to be doing what we're doing because they know that there is a paucity of access to care. And so they were extremely happy and we worked together. Obviously, we use a technology, EMR, for our patients, and because we're developing a research portfolio, because in oncology, one of the biggest issues is that lack of data from the African population. So we've got an ethics committee. We're regulated by the National Health Ethics Committee. We've got an ethics committee that's 11 strong. We are now collecting blood and saliva samples from our patients with informed consent. And we're now going to be part of a number of clinical trials, as well as population studies, genomic population studies with groups internationally. That is where you can put yourself. And yes, we're one end of the spectrum, but that end of the spectrum has to be in healthcare. They're the Mayos and the Clevelands and so on in the US. They're also the people in the healthcare sectors in the US that are the public sector based, where people can't really access much care because they don't have health insurance. It happens everywhere in the world. But where the diaspora can work and really have trust is that things work in Nigeria, okay? It may not be straightforward. It works better, of course, in the private sector because we have access to where we can, and it's not easy, the finance and so on, to make sure that the infrastructure is in place, but also because we have colleagues that we can collaborate with and work with to make sure that we're doing the right thing. So I want to just say to everyone, it is possible to do this. And even if you cannot come back to live, I know some people are coming for a year or whatever, collaborate with those of us who are there. Most of us have space in our infrastructure. The Duchess International has 100, I think, beautiful private sector beds. It's got theaters, it's got a cath lab, and so on. You don't have to come and reinvent the wheel. You don't have to come and build your own. You can come and set up your own practice within the Duchess. I am Dr. XYZ at Marcel Ruth, and we will support you because we know we need the support, we need the help. We know our patients need that support and the help. And the better that we get, we're going to be able to support the public sector better, which is why I do a lot of work with the public sector across the National Medical Association, Medical Women's Guild, and so on. And it's why I, at the end of January this year, together with 15 other incredible women in the healthcare sector, we launched the Women in Healthcare initiative, which is open, please, to all the women in healthcare in the diaspora. So please do join us. We're doing incredible things. We're doing leadership programs. We're doing mentorship workshops. We're going to sort up internships. And so the ones who are abroad can help us with that. There's so much that we can do, but with a strong private sector workforce, which is also showing the government that where there's the money, which is what Dr. Oshini was referring to, and Dr. Ogumbi and so on, that things can be better. And so I think that's where we're playing our own game. And obviously we're leveraging, we do, even our chemotherapy, we're now doing e-prescribing. Our radiotherapy is totally technology driven. We try not to do any writing because in our sector, we're very worried about errors in terms of treatment and so on. So everything is done electronically where we can, but also we're using the technology as our base for our software to collect this data that is so needed. It's been a lot of work, and I'm very thankful to our R&D lead. It's something we don't have to do in private practice, but because we understand that this needs to be done and that Nigeria has the opportunity to contribute to these population-based cancer registries, we're taking the lead together with the National Institute of Cancer Research and Treatment that Dr. Tunji Alausa has just, and Professor Pate, the Ministers of Health have just put into place. And we're all collaborating across private sector and public sector. And that's the way to go. But for the people on this platform, there's work to be done. Nigeria is never going to be easy, whichever way we look at it, but by doing what we can, either by coming back or even if you can't, I mean, I turned 62 weeks ago. I came back after most of my children are educated, so I can understand that, but you can come back and work with people who are already there. We need your help, and we can also support you to make it easier. The finances, I think has been discussed at length. I'm just saying, there's also the commitment and the will and bringing back this intellectual property that is huge on this platform to come and help us make things better, both in delivering the clinical care, but also in doing the teaching and the research that needs to be done in Nigeria. Thank you.
Thank you so much, Dr. Lubute. And again, this is the reason why we're hosting this webinar. We cut across different sectors. Today is the healthcare sector. And I'm very excited and glad that, our panelists are actually collaborating what the vision of Napac CDI is, which is going to leverage the expertise of the diasporan community to impact our home country and, of course, the continent at large. We all are already used to this common phrase out there. If Nigeria can get itself together, the entire continent will get itself together. And that's just a fact because of population, because of our skill set, and more importantly, because of the level of our diasporan influence across the entire world. So I do appreciate all that you've just shared and re-echoed and emphasized that the opportunities are there. And we don't need to really reinvent the wheel. This is why we are trying to be that bridge, and we are building that bridge of trust, of opportunities, of accountability, of leverage, okay, for most of our diasporans who wants to go back home, because the reality of those challenges is still there. But that's only when you are willing to compromise and you're also not speaking to the right, partners on ground. So I'm glad that, Dr. Elebute actually emphasized on that. And for sure, there would be a call to action. This is not just a webinar for conversation informational. No, it's a call to action for civic, private sector opportunities, and collective global efforts to improve on our healthcare sector. Still on the same feedback, I would love to hear from Dr. Ogubi. How are you leveraging technology, sir? So yes, render your services, and more importantly, also projecting into the future to continue to position your institution, ahead of the curve and perhaps even of the same standard as we will probably have here in the diaspora. Dr. Ogubi, sir.
Yes, in terms of technology, I'll piggyback what my colleagues have said. Well, certainly at Duchess, of course, again, we're privileged to have a well-equipped facility. Dr. Olusegun has kindly pointed out, yes, 100 beds, single occupancy rooms, well-equipped, MRI, CT scanner, but as has been pointed out again by Dr. Lucy and I think all our guests, telemedicine, very, very important. And so that is, in terms of telemedicine, that allows us to tap into the intellectual capital, as Dr. Lucy has again said, intellectual capital of the diaspora and others. So in other words, we can bring in experts in so many fields, even if they may not be present on the ground, who can help us through telemedicine. And of course, we have the facilities to allow this telemedicine to occur as well. So that is key, because unfortunately, because the healthcare sector is not well funded, that is one of the factors that's led to so many people leaving the country, including so many professionals, not just doctors, nurses, physiotherapists, physical therapists, occupational therapists. All sorts of skills are unfortunately lacking in Nigeria because of poor funding. So one way to get them back, of course, we were trying to attract those people back in general, but one way is through telemedicine. Again, that's a way that people can help out back home. But of course, electronic medical records, obviously, yes, we definitely have that, and we as much as possible, we're trying to actually be paperless. But one big factor, which has been mentioned that I'll just emphasize, is health information management. Health information management is so important, and that speaks to what Dr. Onusi has mentioned. She's talking about, of course, cancer registry. That is, it's so important in oncology, but throughout medicine in general, health information, the public health people, in public health, which of course includes the primary care system, but also in, of course, so Dr. Oluwogi, this is a very, very important in his sector, but also in Dr. Oshuni's sector as well. We're talking about, of course, health insurance. Data is vital. We need robust data so that we can see the extent of the problem and so that we can then better find solutions. The data is key to everything, but one is thinking in terms of course, health insurance, so that they can draw accurate actuarial tables, and they can best determine the price points for health insurance premiums, for example, and so as to make their models work so that they can be profitable and provide good service. So I would say, when it comes to technology, health information management is just key. Unfortunately, there are people who have this expertise, and more people are being trained, including Nigerians being trained, including the diaspora. So we should encourage these people to come back and bring those health information management techniques back. And I know that fintech is a strong sector in Nigeria, and I'm so proud also of the fact that some of the electronic medical record systems software is developed right there in Nigeria, where we're able to utilize that. So we need to use this information in health insurance, or rather health information management insurance, information We need to use that very, very robustly in Nigeria. And the government needs to really be a part of this in terms of developing the data, gathering the data, and utilizing the data very adequately. So I'll leave it there for now.
Awesome. Thank you so very much, Dr. Ogumbi, and getting to know that individuals like yourself and your institution basically leveraging not just technology, but I love how you were able to emphasize the collaborative effort between the HMOs and even other private sector practitioners who are into R&D, such as Dr. Alebute. And again, that's the synergy we want to see. Because we hear all this all the time. The challenges are there. How do we start? That's it. We just need to start with what we have and the few minds that can actually activate these opportunities and provide solution. And this is exactly what we are about. We're wrapping up now. So in our closing remarks, as I would basically go next to Dr. Oshuni to share his insight, I want us all to begin to think through all that we have heard today, not as the challenges, but as Dr. Liberty has clearly emphasized, it's the will, it's the determination, it's the intentionality to make sure we connect with the right minds to uphold the same level of standards that we operate by here in the diaspora. Okay, when we go back home, and not look at home as a lower standard or substandard economy or country or the citizens themselves. Again, thank you all for being very patient with us today. We knew this sector would actually create a lot of conversation. We didn't want to actually just have it, very soft as it were. It was important to listen to all our speakers because they've actually taken so much time out of their busy schedules and all their years have actually tried to summarize in just this few minutes. We can't exhaust it all. There will be subsequent webinars that would actually have more focused conversation, as I would definitely love to even see them come back and actually let's brainstorm. Because again, we can talk, but we need to begin to think solutions and prefer solutions and actually document those solutions. There's a part of the public sector, our legislators, our representatives, our executives in government, we need to hold them accountable. But how do we hold them accountable if we can't prepare for them a roadmap? Okay, because sometimes that's their problem. They really do not know where to start from. So we can actually start building this case study of the private sector partnership, the diaspora partnership, present to them, working with the different access and departments that we all actually have influence in, and begin to execute. And the next 5 years, we're looking back and saying, oh wow, we're glad we started. So again, this is the Napac CDI monthly webinar series. We do this every first Saturday of the month, 11:30 a.m. Eastern time, and depending on your time zone, it would always, be one to look out for. Connect with us on our social media handles, connect with us on our website to keep yourself updated of some of the opportunities, as well as, subsequent webinars to come. And of course, if you're interested in going back home, you want to connect with some of the, very informed professionals and entrepreneurs like some of our guests will be able to help mobilize that. You're also in Nigeria, you're trying to, get access into the diaspora for expertise connect or even expand your business into the diaspora. We're also the gateway for that. We do have a strong presence in the public and the private sector, and this we're leveraging to actually, create informed solutions and provoke thoughts on how we could sustain for the long run some of these key sectors that is critical to our image and integrity as Nigerians. As we wrap up again, I would go now over to Dr. Oshuni. From your perspective of the HMOs, how are you leveraging technology? How are you basically also guaranteeing or helping to refocus the minds of people to trust that their content, their information is secured? And of course, with individuals like yourself, that you put your patients first above, the money, as it were. Dr. Shunei, over to you, sir.
Thank you very much. As a closing remark, I wish to say that it's not all doom and gloom here in Nigeria. On the 19th of May, 2022, a law was passed that makes it compulsory for all residents of the Federal Republic of Nigeria to have a social health insurance plan. So that's now compulsory. And you know how compulsory things are, that drive people into an industry. We have a new helmsman for the health insurance regulator in the person of Dr. Kelechi Ohiri, who himself you could call a diasporan of sorts. His last job was with Gavi, the Vaccine Alliance. He's worked with McKinsey, and he's been part of the National Health Service in the United Kingdom. So he's an extraordinarily knowledgeable person, and he's the one guiding this transition from optional healthcare to mandatory healthcare. He's in the process of setting up a platform which will be able to gather all fields of information from 500 million people. It is said that that platform, if it was so required, could actually handle the health information needs of the West African subcontinent. So that is being taken on hand. It will have everything: firewalls, mirror servers, cloud servers, you know, all the bells and whistles, and will stand the most rigorous tests of the industry. You are, of course, aware that Nigerians are very innovative when it comes to fintech,
Right.
and now health tech. And if you see the way we use our phones here, I'm not sure that you can carry out as many transactions in the US on your phone as we can do with our phones here. And that just highlights the principle of leapfrogging. They say the best laboratory of all is history. We don't have to go through the tortuous paths that other countries have gone through, taking them 200 years to get to where they are with health information. We can do it all in 1 year. And that is the advantage that we want to harness in building this backbone, this super highway of information for healthcare in Nigeria. So health insurers will plug into it, health providers will plug into it, enrollees will plug in, the regulator is plugged in, and hey, it's one ring that catches us all. I think that is a good thing, and stand by. We'll be hearing more about it in the weeks and months ahead. Thank you very much.
Thank you so very much, Dr. Oshuni. That was uplifting. And I'm glad that, you know, we heard it very bluntly from you earlier. And likewise, you've actually shared that there is hope in the horizon and actual practical work that is being done, which needs to be supported. So again, we're wrapping up now. Of course, we've noticed and we've been monitoring the chat box. Some of the questions have been addressed by some of our panelists. Some questions have not been addressed. We will be reaching back to you. Please feel free to share your information directly with, you know, our back-end support. We'll be able to address those questions directly. And of course, again, visit the website, connect with us, and we'll be able to also address whatever concerns or needs that you may have. And we're always open to advice. I mean, we do not know it all. We're always looking to expand ourselves. So if you have further ideas, opinions on how we can improve on not just, again, the webinar, but at least going after some of this critical infrastructure, as well as complementary efforts of some of our colleagues, you know, in the diaspora who are on ground in Nigeria as well, would definitely appreciate you reaching out to us and see how we can leverage our collective network and resource. So again, wrapping up as quickly as we can, Dr. Olubogi, we appreciate you making time for us. Please go ahead with your closing remarks.
Yeah, thank you very much. It's been an eye-opener and a very wonderful session. I'd like to add my voice to the fact that it's not all gloom in Nigeria, and the diaspora can contribute by helping to build infrastructures. You can come home, build a PHC. You can do it in form of a private-public partnership. You can also build, operate, and transfer. You can also, you know, just build and, you know, donate to a particular government, maybe in your state. You can also adopt a public health facility and from time to time donate equipment to them. I saw in the chat box where somebody was mentioning that they have access to sending fairly used equipment back to Nigeria. I believe strongly that this equipment will be valuable in our practice in Nigeria. I mean, of course, where you don't have any at all, whatever you can get that's fairly good will suffice. So I want to encourage our brothers and sisters from the diaspora to, as much as possible, find a way to tap into what's happening in Nigeria and contribute your quota to the public health sector in Nigeria. Thank you very much.
Thank you so very much, Dr. Lubogi. We appreciate you yet again for all that you're doing. We know it takes a whole lot. I mean, you could have actually also joined the numerous folks exiting the country as a young, professional, but there you are, struggling it out, leveraging your expertise and, of course, networks in the diaspora to improve on the sector and be close to the grassroots. Again, we appreciate you. Thank you for honoring us. And we'll go over to, Dr. Lebute. Again, ma'am, I'm so glad that, you are one strong CEO, I would say, okay? Not just your experience, but we know what it is, sometimes when we talk about home, the gender, equality that we also know most of our female leaders are actually, ensuring and fighting every day, whether spoken directly or indirectly, we know it's there. So it's always, for me, a thing of pride that is worth, applauding and amplifying when we have great professionals like yourself who could have just chosen to be in your comfort zone here, take the battle to the to the forefront of the war, as it were, and doing a great work in delivering and pulling others alongside. Again, thank you, ma'am, for honoring our invitation. We look forward to more deliberation with you, but please go ahead with your closing remark.
Oh my gosh, what am I supposed to say to that? I think you closed it for me, to be honest. But I want to disclose that I'd never met Napac CDI before today. So everything I've said are my own thoughts and so on. And even me saying there's a lot to be done and there's a lot that the diaspora population and doctors, healthcare or otherwise can help to do in the country is the truth from the way that I see it. And I feel that actually making that decision to go and actually live in Nigeria to do this. Because there's a model where people, a lot of doctors are coming and going, I really believe that honestly, to make the impact that we need to make where one can, it is, you need to immerse yourself. And also sometimes, the issues and problems you might face in the first year or so will probably make you pack your suitcases and go back. I hear that from a lot of people. I did try to go back. I left after a year. I left after 2 years. We all know that in life, every relationship, like a marriage, if we all look back at our first year of marriage, maybe the first 2, none of us will be married today, right? For those who are married, seriously, you need to take the long term view. You need to also take the long-term commitment to what you're doing and remember that while you're sort of doing it, for me, this is a gift from God to go and do this. And honestly, it fills me with joy every single day. People already on this platform who are saying, you've looked after my niece, you're looking after my mother, my father, even though I've not been there, and we're not perfect. We're not going to get it right all the time, but we are doing our best. Again, I will say there's a lot to do. I do think there's also the financial gains to be made. I'm not the financial expert, but I do, in the private practice in particular, obviously, there is the Dr. Ogumi and I are not sitting in Lagos, drinking air. That's the truth of the matter, okay? All right, so, and we didn't go back to Lagos and drop our lifestyle by 100% either. So if that, I'm sure you get what I'm trying to say. There is gain, but you need to also do the work. I think the problem has been when people think, I'm just going to go to Nigeria, I'm going to meet XYZ, who's going to take me to the government, and I'm going to make a shed load of money, and I'm going to turn back, and I'm going to be out of there in 10 minutes, and I'll have made $10 million. Well, if they did it before, great. I don't know, you can speak to Dr. Oshuni, but I'm not sure you're going to do that now. And frankly, I don't think it's the right way to go. Because I think at the end of the day, if we're doing our job, if we're looking after these patients, if we're providing good health care to our patients, because if they go abroad, it's extremely expensive. Let's not get it twisted. It's not cheap if they went abroad anyway. A lot of people are dropping even their Bupa insurances. I don't know about the US because it's so expensive. Guess what we've just done? We've just partnered with Leadway Insurance, HMO, and we put together, it took Mr. Odunsi, a year to come up with this package. We now have a Leadway Marcel Ruth healthcare insurance, which has 10 million naira worth of for cancer care, if you should ever, God forbid, but if you should develop it, or if you buy it for your relative or your employee or whatever, that's what they will get. It has got very good coverage in there. And it's a Nigerian-made insurance package together with Leadway, together with us. It's called the Leadway Marcel Ruth package, right? So, it's only by being there that you'll come across all these things and begin to find the solutions that we need instead of just all the questions all the time. But guys, it's time to do. It's time to do. There's a lot to be done, and we will really, really welcome your effort, your money, your support, whatever it is. And obviously there's a platform here through which to do it through, but of course there's us on the platform who will be happy to speak to you or help if we can. But it is doable. And that question of bribe, I've seen it again twice on this platform. I'm still telling you, and we set up Marcel Ruth and we didn't pay anybody any bribe. It is like, it is doable. If you know what you're doing and where you want to go and you're doing it for the right reasons, you'll get there. And we can positively invest and positively make our money by also doing what we need to do to improve healthcare in Nigeria. Thank you.
Thank you so very much, Dr. Liberté. I mean, I'm sure maybe somewhere down the line, there's an interest in public service. Be rest assured, we will galvanize.
I'm retiring after I don't know about doing. I've got 4 more years. Dr. Shinu, people like Dr. Shinu, there are not many of them, right? I'm looking at my retirement date now. Do you understand? Happy to do this, and I'm doing the succession planning already. And that's why I'm doing the residency program, so we can train the people who are going to run these places. But thank you.
Brilliant. Glad to hear that. At least you're beginning to clone yourself indirectly. Yes. So that's acceptable. Appreciate you again. Thanks for honoring our invitation. And of course, I would also re-echo what she said earlier. It is actually very strategic for Napac CDI to make sure these conversations are not ducted. Okay. Every one of our panelists did not have a full insight as to exactly how this conversation or dialogue was going to go, because we want them to come in with a genuine openness of their heart to speak to the people, because we strongly believe people have information and access to Nigeria. The diasporans are not far from Nigeria, even though by distance we may. So it's important that we amplify the truth of what's going on the ground and actually begin to provoke the trust that has been missing amongst us. Even here in the diaspora, we have to call it what it is. It's all about trust. Once the trust is built, we can now start identifying platforms like ours, professionals like those on the call, to begin to make very strong economic and long-term impact of generations to come, because that's really why some of us are doing this. It's no longer just about us. It's about the generations lying ahead. And of course, for us to build the strong Nigerian Black community that we want to see emerge, across the entire world. Dr. Ogumbi, we also appreciate you. You're in between activities over there, but you've been very patient and very dedicated, communicating with us and of course addressing some of the conversation. So sir, in your closing remark, would appreciate you to just share your thoughts. What's the future for you and the Duchess Hospital, and how can we continue to support what you're doing? Dr. Ogumbi, over to you, sir.
Thank you very much. Well, I think I've alluded to this before, and I like to tell people this. By this I mean returning to Nigeria has been the most satisfying thing professionally I've ever done overall. It is very satisfying. Nothing better than taking care of people from your home country. Nothing better than being able to return home. It's very, very satisfying. It fills one with pride. Being able to contribute one's own quota towards providing good health care, and then really trying to provide the very best possible health care for our own people. And so very satisfying. To me, there's been nothing more satisfying than it. Yes, Dr. Liberté has pointed out that we're not eating air, so to speak. We're we're not doing it for free. But of course, if I'm not claiming that I'm making the same amount as I was making in the US. So one is not doing it for the top dollar. On the other hand, but one has a good lifestyle in Lagos, and bear in mind, of course, that the funds go further in Nigeria, all things being equal. So
Right.
from a diaspora standpoint, I'm not going to claim that life is easy for Nigerians. It's not. But from a diaspora standpoint, your funds go further in Nigeria. So that helps. So I would encourage those who can return to return. It's not an easy thing to do, but certainly, as Dr. Odusi has said, there are other ways you can return for periods of time. You can go in for a week at a time, help out, or you can do telemedicine or a combination of things like that. So it's very, very satisfying. Yes, I agree with her. It's time to do. We don't just curse. Then one famous person once said, "Don't just curse the dark. Light a candle. Light a candle. We can all light our own candles. We can all do something to help our country to be the great country that it should be. For the sake and pride of us all and all Africans and all people of our race, frankly. It should be a great country, and we should do it. It's time to do it, and we can do it, and we can see that it can be done with people such as my fellow panelists. I'm proud of them all, in their various fields. We can do it, and we must do it. So thank you very much.
Wow. I mean, they've said it all. Thank you so very much again to all our panelists. We reached out to you. Some of you, yes, we have existing relationships. Some of you, we just connected, but you saw the need to actually come lend your voice for the common interest that we have, which is to improve on the economy of our country, improve on the sector, the lifestyle, and the imagery, I must emphasize again, of us as Nigerians. Yes, we could be very successful in the diaspora, but until our country has that strong reputation of respect across the entire world, our success in the diaspora still remains questionable, in my opinion. And this is why we are doing what we are doing, to mobilize the resource and the voices of the Nigerian diaspora, our professionals' expertise, to support individuals like our panelists who have actually taken that very bold move to be on ground in country. They've actually aired their opinion. They've shared their expertise. Now they're calling on us. It is our duty to complement some of this effort of theirs. This has not just been a webinar or a conversation. It's been a charge and a call to support, to make economic success. So we will be encouraging you to please use the chat box, share your contact information. We will be glad to connect with you. Reach out to us via our website and through our social media handles as well. There's been a call to action, the need for leadership, the need for governance, the needs for skills development, the need for infrastructure maintenance, the need for operational funds. Just imagine if about 5%, and this is me going a little beyond even what Dr. Oshini said, okay? Just imagine if we can actually dedicate and intentionally commit our remittance of 5% to the healthcare sector in Nigeria. Not necessarily even building new facilities, but improving on existing infrastructure. We could just imagine what that's going to do to the economy. So we still have families back there. So this is a call for us all to begin to think in this line, spread the word. We would be connecting again with some of our panelists for us to begin to develop the process that we can work with those like themselves and maybe even target a few numbers, okay? Because sometimes it's about a proof of concept. And this is part of what I'm throwing out to even to my colleagues who are on the call now. We as Napac CDI would take this as a case study, would galvanize a group of the aspirant community, leveraging on certain access and influence that we have, and begin to work with individuals like some of our panelists for a focused fund that we can mobilize and maybe put a time frame to it and come back on this call and share with the public what we have done. This is the call. This is why we are doing this. So please reach out. Again, I am Sahida Delaire, Business Director, Napac CDI. I appreciate you taking time to join us. If we didn't answer all your questions, be rest assured we'll connect with you. At this time, I would actually yield and hand over to our Chief Operation Officer, Dr. Veronica, who will be wrapping us up. Thank you all for joining us. And again, our panelists, thank you for honoring our call. Dr. Veronica,
I think
over to you.
you've forgotten my last words.
Oh, well,
Shini, my
hey,
God.
Dr. Shini, not a problem, sir. I'm sure Dr. Veronica would accommodate. Go ahead.
Absolutely. Please, sir, we need it. So we're listening.
Okay, thank you. I don't know how Napac CDI chose this day, but it's an amazing coincidence that on the 5th of July, 1948, exactly 76 years ago, the National Health Service of the United Kingdom was launched. It was a seismic event in healthcare globally. Nothing like it had ever been attempted. And it meant that on that day, every single individual in the United Kingdom had access to affordable, accessible, and high quality healthcare. How does this translate in Nigerian terms? A decade ago, the McKinsey, a well-known consultancy company, did some work for the World Bank. And the publication at the end of the work was titled The Business of Healthcare in Africa. What the Business of Healthcare in Africa publication attempted to do was to show where investable funds could go in the entire sub-Saharan Africa. It reveals that 25% of the health burden of the entire world is domiciled in sub-Saharan Africa. Of course, you know that 1/4 of sub-Saharan Africa is Nigeria. So we probably carry between 8 and 10% of the global health burden. It also said less than 1% of investable funds in health are coming to Africa. It also pointed out that Nigerians, for example, were spending between $1 and $2 billion a year in health tourism. So there are gaps where investments can come into health. The uniqueness of healthcare is that it's agnostic of the type of government you have, people will still fall ill. It's agnostic of your weather patterns, people will still fall ill. So illness is ubiquitous. And like food, when ill health strikes, it has to be taken care of. So I will encourage members of Napac CDI to investigate, research, find out just where they'll get the best blast for their dollar. And I can tell you there are over 100 angles to it, where not only will you be doing something for your co-nationals, your fellow citizens of Nigeria, but you would also gain value. There will be a value proposition and a sociopreneur proposition encompassed in one. So I encourage you, and I thank you for this opportunity. Thank you very much.
Certainly. I wish we were like on a platform in person. We'll just be bowing and, this has been exactly what we dreamed of and more. Thank you so much. We have a powerful panel. People anticipated it. This is actually the highest attendance we've had, just so you know, because people were looking forward to it. And I know that they got their worth and more. I think that the message here is clear. You're saying to us, absolutely, yes, we have issues. We are in it and we're making things happen. That's one. So instead of complaining, do something about it. Add your talent. And I have to borrow the words of Dr. Ogumbi, light the candle. And what's amazing about this panel is that you continuously, each of you gave us facts. You didn't sugarcoat it. You're telling us what you're doing. We're seeing you actually, each of you bring a lot of hope to us here in the US. When we see Duchess, people are dreaming of, oh my God, it's like a hotel. And, you know, cancer is a major issue with all the foreign goods coming in, and are people choosing to buy plasticky versus eating their, you know, what they call ewedu, you know, the natural stuff. So there's more that need the cancer support. Dr. Shuni, you're a leader. Oh my gosh. Dr. Lugogi is a young and brilliant. He's so young, and I'm amazed at what he's done. Dr. Lebute, you gave up your thing to be with us. Dr. Ogumbi, you encouraged. You've been here. Many said, okay, we'll be there. So thank you so much. And we thank you. Napac will reach out to you. So many people want to reach out to you. So we will connect and make things happen together. Thank you. Thank you, Dr. O. Everybody, Mr. Okusanya, our chairman of the board, and his wife, they're here. We want to really honor them. They facilitated a lot. Madam CEO, CEO was just instrumental. Our CFO, Mr. Doherty, and our super duper eloquent moderator and director of business development, Mr. Said Adeleye. You did it again, international presenter. So we look forward to seeing you. We hope that we actually will come back to you when things start happening as a result for a follow-up. Thank you, sirs. Thank you, Dr. Elebute Odusi, Dr. Ogumbi, Dr. Lugogi, and Dr. Shuri. Thank you, thank you, thank you. Thank you, guests, everyone, for being here. I see you all. Thank you. Mwah. All right, Miss Rahana, thank you. She's going to post it, so check all of our social media, our YouTube, Madam Rahana to Abubakar, our social media contact will be posting everything. So catch up there. And reshare. Miss Ogule Olanike, thank you. Thank you, thank you, thank you. Thank you, everybody. Dr. Akinloye, Olorungbemi, thank you, sir. We really appreciate all of you. I wish we had time. We'll be calling all of you. Kosoko Mujid, thank you. InfoPower International, let's connect. Mr. Vice President of Napac, Mr. Yomi Lawal, Esheun, thank you. Dr. Augustine Wabo is my big brother, thank you. I'm trying to catch everyone. InfoPower, connect, connect with us. Stena, Zokoto, Mutiu Okediron, thank you. Yusuf Omobambo, Rachel, thank you. Nene, thank you, Nene. Awesome. Anna Koskinaris, thank you. Oluwatishe Adetola, we're happy you're here. Olukemi Wallace, I'm happy you're here. Mr. Odunikon, you'll get all the information. Olukemi Wallace, thank you. Brickstone Associates, please connect. Let's work together. Oluwatishe Adetola. Mrs. Campson, thank you. Mrs. Ajike, thank you. Aisha Ibrahim, we're so happy you made it. Folashade, thank you. Oluwapelumi Adeniji, thank you. And Blessing Chike Track Mama, thank you. Connect with us, register. Kolawole Owoka, thank you. Ife Ricketts, thank you. JBA, thank you. Temitope Jayesime, thank you. We're so happy you all joined us. See you next month, first Saturday of every month at 8:30 a.m. Pacific Standard Time. Join us. Thank you, everybody. We appreciate you. Isiamo Fuegbune, thank you. Chiedu Fuegbune, thank you. Bye, everyone.